You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. We have Texas's implant dentist, Dr. Sam Nechamkin. Dr. Nechamkin, welcome to the program.
Thank you. Glad to be here.
Now, your patients call you Dr. Sam. Dr. Sam. Mm-hmm. In fact, your slogan, we got to bring it up on your commercials. I guess you've been running those it's Dr. Sam can.
Correct.
Do people say that, like joke around about you?
Oh yeah, they love it. They love it. Yeah. No matter where I go out to eat, it's hilarious. They if something breaks, who can fix it? Dr. Sam can.
Dr. Sam can. Okay, good. Good. And you get recognized where you are.
We do. Yeah.
On the street.
Yeah.
Now, I know you brought a lot of photos. So we'll try to get to as many of those as possible. But for people that don't know your practice, like who's the typical patient that's coming in for dental implants?
Well, obviously, for dental implants, it would be there's a lot of different cases. Okay, there's a lot of different categories. Okay, it could be that maybe somebody just missing one tooth, just needs one tooth replaced, or maybe it's a congenitally missing tooth, that one they always wanted to replace, or it could be possibly somebody who has that feeling that they're on their way to dentures. Okay, that they're losing their teeth,
like really bad teeth.
Yeah, like they're in pain. They haven't been to the dentist in a while. They're scared of the dentist. And those people, they come to us because they want a brand new set of teeth.
Okay.
And then there's that third category of people that already have dentures, that already feel like they've solved a problem, but now they have a whole brand new problem. They have dentures that have become loose. They can't bite down hard on their food or it hurts their gums. They speak too loud and their denture falls out. Or they want to go scuba diving. You can't bite on a regulator if you go scuba diving.
Okay.
Or I think everybody's seen that YouTube video of the lady who jumps out of the airplane.
Oh yeah, and the denture falls out.
The denture falls out, yeah.
It's probably funny that everybody but her, right?
She's probably mortified when she lands. So, yeah. So, that's the three categories of people that come to us in search of dental implants.
Now, at the top of the program, we said no more dentures. You believe that? Like nobody really should be wearing a loose-fitting denture?
Absolutely.
You don't like dentures?
I don't. I really don't. I mean, I couldn't imagine wearing a denture. I mean, if I lost my teeth, if I had a car wreck, I would just want my teeth back. Any way possible. Because, Randy, I like to eat.
Okay.
I like to eat. I like to eat steak. I like to eat corn right off the cob. I want to look good. I want to be able to speak. I want to be able to smile. But the main thing is that if you don't feel confident in your smile, I mean, that's where everybody looks.
Okay.
When you speak, everybody's looking where? Right here, because they want to hear what you say. And if you don't feel confident right here, you're going to hide your smile. Okay.
So a lot of people hide their smile? I mean, do you spot it as a dentist? Like you could spot like that guy is hiding his smile.
Absolutely. Yes. Usually, and I always tell my wife this, if she thinks somebody's mad at her, I said, well, maybe it's just because they're not confident in their smile.
Okay. Because
we fix people's smiles, and after we're done fixing their smiles, they can't stop smiling.
Good. Now, dentures, we're talking about denture wears for just a moment.
Yes.
Are there a lot of denture wears where you are?
Oh my goodness. I mean, there are denture wearers everywhere. You would not believe. Just to give you a for instance, okay, AT&T Stadium where the Dallas Cowboys play.
All right.
Holds over 100,000 people. You could fill it 10 times with denture wearers.
Really?
Dentures are everywhere.
So if there's so many denture wearers, right? Well, then why aren't they all doing it? Why aren't they all coming in to get like a brand new set of teeth that don't come in and out?
Because, Randy, once you have your teeth extracted and you get a pair of dentures, you don't go to the dentist anymore.
Okay.
So you don't know your options unless you go back to the dentist. But let's back up. Let's go before dentures. These are folks that are used to going to the dentist, having problems taken care of. They've been in pain, for whatever reason. Their teeth hurt. They can't chew. Embarrassed about their smile. And they think, hey, all I have to do is just have all my teeth extracted and problem solved.
Okay.
But then they find out they have new problems. So with this new set of problems, they don't know where to turn. They don't know what to do. They cover their mouth. They think that their life will always be like that forever because they don't go back to the dentist. You see what I'm saying?
You say you could help the denture wearers the most. What do you mean by that?
if somebody comes into my office and they're already wearing dentures, okay, and they already have a problem, all right, well, oftentimes they hear that they may not be a candidate for dental implants. But that's kind of weird now, because now we have newer technology. We can put dental implants where we couldn't put dental implants before.
Okay.
And so we can put the dental implants in, or if maybe they're not a candidate because they don't have enough bone, well, we have techniques to make enough bone, and then they can have a set of teeth that lock into their mouth. And that's what they want. And that's what
they can eat
deserve.
whatever they want.
Eat whatever they want. Eat whatever they want. Go back to chewing foods that they can't chew now. Go back to chewing and not hurting. Go back to chewing and not excusing themselves from the table to go clean out the food underneath their denture.
Now, you're a periodontist, right?
Yes.
You're a specialist, but you also do like general dentistry, which is very unusual, right? For periodontist, you're a board certified periodontist.
Board certified.
And you guys are what? The gum specialist, the bone specialist?
We're the foundation people.
Okay.
Foundation people for teeth. So you wouldn't build a brand new house on a poor foundation, right? So you need to make sure the foundation is as healthy as it can be. So, and another thing is periodontists are especially trained at saving your teeth, okay? So if, just put it to you this way. There are special centers where you can go and have all your teeth extracted. But what if you don't want all your teeth extracted? What if, just say, maybe the bottom teeth need to be extracted? Well, you would want to go to a periodontist to help save your teeth, right?
Okay.
So that's what we do in our office. We'll take a look at all your teeth, and I actually prognose these teeth. We take a look at the structure of the bone, the structure of the teeth, and we give them a good, fair, poor, or questionable prognosis. And if they're hopeless, then we know we have to go to something else. So the difference between a periodontist and a general dentist is we're going to look at everything from top to bottom, soup to nuts, A to Z. But back to your original question, why are patients thinking they're not a candidate for implants? Well, some people think they're too old.
Well, how old can you be?
Well, age really doesn't matter. Let me just tell you about this one patient. Had a patient come in. She was a widower. She's in her 90s. Okay, she had spent the last 4 to 5 years at home. And she just decided, hey, I want to get back out. So she comes into my office. She says, I want you to fix this. She was missing teeth, her front teeth. And she was embarrassed. She wouldn't even go to church. She watched church on TV. So she comes into my office and she wants implants. She's 92 years old, right? So I made a mistake. I was a very young periodontist at that time. And I said, Mabel, are you sure you want to get dental implants at 92? She said, Sonny, my oldest sister lived to 115. I'm just a young chick. So with Mabel, in one afternoon, we placed dental implants and we locked in a brand new smile. I mean, what were her options before? Her options were a denture. She was not going to have a denture. There is no way.
That's why she came to you.
Oh yeah, absolutely. I guess she may have saw me on like a billboard. We're on billboards, we're in magazines, we're on TV. So she comes in and she says, I want a brand new smile and I don't want anything that goes in and out. And that's what we gave her. So after that, she could go to church. She got involved in groups and she got out of the house. And one of the most important questions I asked her after I finished all this was, would you have done this sooner? And she wished she had done it a lot sooner.
Is that what everybody says? Like, I should have done this years ago.
You know, I think, Randy, that there's people on the couch, you know, that are sitting there thinking that there are no options. And I had a lady the other day, a lady who was depressed, a lady who was seeing a psychologist. She comes into my office, and you know what she didn't realize? You people are nice.
Okay.
I should have came here a lot sooner. And so for those people, I mean, here's the thing. You don't have to go to a dental office and be thrown in a chair and start. I mean, you can come to our office. We give you a tour of the office. You can meet the doctors, and then you can make a decision on your own if you want to come. And so that would be a lot easier than waiting 3 or 4 years to get the courage to go to the dentist. So this lady who was seeing a psychologist, she comes in, she gets a brand new smile, and she's feeling confident again. I mean, the teeth are they're locked in. She doesn't have anything to worry about. She can eat, she can chew, and most importantly, she's getting out of the house. She can talk to people now. She doesn't have to cover her mouth anymore when she smiles or talks. She can eat foods. You know, when you go to a restaurant, what do you want to eat? Do you want to eat the foods that you pick out that you like, or do you the ones that you think you can get by with, the ones you think you can eat with?
That's a good point. So that's what they do. They look at a menu like, what could I eat?
Oh yeah.
Or what could I eat in front of my friends?
Oh, there's foods on the menu they're terrified to eat.
So denture wearers have a tough time eating? I know it seems like an obvious
Oh yeah.
answer to that question, but
denture wearers Randy, they have to take food and they have to cut up in really, really small bites, because you lose your chewing efficiency. You know, with people with teeth, they take it for granted. I mean, you can chew, 15, 20 times and you're done. Denture wearers, they're going to be chewing like 40 or 50 times the same amount of food because they lose 60% of their chewing efficiency. So just by getting dental implants and locking those teeth in, they can chew much better.
So what about pain though? Seems painful.
Well, in my office, we offer IV conscious sedation. So with conscious sedation, you just snooze. And most of my patients wake up, they didn't feel any pain. They actually think they wake up at home. They come out of it, they wake up, they look in the mirror, they see their beautiful smile, and they're happy. So you don't have to worry about pain. I would say probably, between 75 to 90% of my patients, they just take a Tylenol. They just take ibuprofen, something over the counter. They don't have to take anything major. Obviously, everybody heals differently. But the vast majority of the patients, they have minimal pain.
Okay. Back to the denture wear for just a moment. Isn't it true though, if you've been wearing a denture for like 20 years, you don't have enough bone to do this? That's one of the problems.
That's not necessarily true, Randy.
Okay.
Randy, you just need to come in for a consult. Let us take a CAT scan. There are areas of the mouth where we can place dental implants that couldn't be placed before. Or maybe they were seeing a dentist that wasn't as trained or wasn't a specialist. In our office, I'm a specialist. I have 2 other dentists. We all have at least 25 years of placing dental implant experience. So you need to go to a center that can do it all right there and do it every day, day in, day out.
So the patients, because I think you told me in the green room, they come in and say, I was told by another dentist, I don't have enough bone. Mm-hmm. And you were able to do it.
Absolutely.
So what are you doing that's different than these other guys?
You can have a whole set of teeth just on 4 dental implants. You don't have to have a dental implant for every single tooth that you lost. So by strategically placing 4 implants, we can put a brand new set of teeth that lock in. Start eating the same day. Start chewing, start smiling. But what I'm really doing that's differently, I think, it's just experience. You go back 20 years when I first started, I don't know if I could have done it like I'm doing right now, but with 25 years of experience, oh my goodness. So after 25 years, you can't help but get better. So people or dentists who are just getting out and just getting started, they may not be able to do what a dentist that has 25 years of experience can do. So especially with the specialty training that we've had in our office.
Okay, now, you brought some photos. What are we looking at over there?
Well, take a look at this one right here.
Wow.
This is a lady who, she was in her 80s, or is in her 80s, and she's a cancer survivor.
Okay.
And people with cancer, they got to take chemo, they may have surgery, they have radiation. It's horrible on the teeth.
Like what, dries out the gums?
Dries out the gums. It can damage the teeth. It can damage the bone around the teeth. And so, she lost some teeth. She lost her back teeth, in fact. And so what I had to do was go in. And here's the thing. Most places would have just put her in a denture. But that's not what we did.
Okay. What'd you do?
We replaced her back teeth with dental implants. Okay? And we kept her front teeth. Her front teeth were fine. So with dental implants in her back teeth, she could eat whatever she wanted again, and she had a beautiful smile, and that was her reward. That was her reward for conquering cancer. Now take a look at this after.
Nice.
It's absolutely gorgeous. And if you look, you don't see any clasps, you don't see any metal. All you see are nice, beautiful, look at the lips. She's wearing lipstick now.
You said this is like an 80-year-old woman?
Yes.
It's a pretty smile.
Well, and she's a beautiful lady. But with this smile, she can eat whatever she wants, and she can smile, and she can speak. And the most important thing is she's got her dignity back. And that's the part that I like the best. When somebody holds up that mirror and they start to cry a little bit, we're right there with them. It is the most rewarding thing that we do in our office, is help people get their dignity back. Take a look at these 2 smiles side by side.
All right.
Okay. This smile on the right, she's not fully smiling. She didn't know how to smile yet. But once her friends and her family start seeing that beautiful smile, saying, hey, your teeth look great.
Yeah.
What did you do something with yourself? She's in her 80s, but the way that we custom made her teeth, do those look like dentures to you?
No, they don't.
The way that we made her teeth we used a youthful look. So there's certain little tricks you can do with the teeth.
Like what?
Well,
when you say tricks.
Make them look brand new. Make them look like there's little curves around the sides of the teeth. Like instead of being sharp, okay, or flat, or looking like they have cracks, or a little bit crooked, These teeth are rounded. They're smooth, just like her face, okay? Everybody likes curves. The teeth have curves. If you don't have curves placed in the teeth, you look old.
Yeah, like I noticed those canines. They're a little pointy. So that's all on purpose.
All
to
on
give
purpose.
that younger look.
Right, so it doesn't
Okay.
look worn out, okay? Now she's youthful. Her teeth are youthful. She feels youthful, and she's acting more youthful. You know, when you go around without a smile, you don't look happy. People think that you're upset when you could be just fine. It's just that you don't have a smile.
So no more dentures.
No more dentures.
And that woman would have had a denture.
That woman would have definitely had a denture if she'd gone somewhere else.
We're going to take a quick break, and we come back. More about the process, what a patient can expect on day one. You're watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.
Hi, Dan Stone for Premier Dentistry. It's been 10 years since I made that call that would change my life forever. Getting dental implants was the best decision I ever made, and the compliments I get every time I smile, it just confirms it. In my line of work, and I'm sure in yours too, appearance really matters, and the beautiful smile Dr. Sam gave me is a huge plus. And embarrassing moments at the restaurant, those are a thing of the past. Don't you think it's time to call Premier Dentistry? You'll be glad you did.
You're watching The Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. Today we have the go-to dentist periodontist in Texas when it comes to dental implants. He is Sherman's, definitely the Sherman's go-to person. We're talking to Dr. Sam Nechamkin. Dr. Nechamkin, welcome to the program.
Thank you.
It's a tough last name to say for me.
It is. That's why we say Dr. Sam.
Dr. Sam, and it's Dr. Sam Can. So no matter,
Correct.
this is what your ads say, right?
It does,
I
yes.
saw it on your website. I guess somebody gets their teeth fixed and they say, I'm hopeless, Dr. Sam Can.
That's exactly
Do
right.
people come to you and actually say that?
Oh, they love it.
They make
love to
little
say it.
jokes?
They do. They make jokes everywhere, all over town. It's funny. In Chili's, something will break. They'll say, who can fix it? Well, Dr. Sam's right out there.
He's right out there, Dr. Sam Can. That's funny. Okay, we were talking about two categories of patients.
Yes.
Those patients with really bad teeth, and they're definitely going to have dentures, or all the teeth have to be extracted,
Right.
or the denture wear. So when they're in your office, what are their options when it comes to dental implants?
First step, the minimum would be just 2 implants, just 1 implant right here and right here. Okay, so that lower denture, that's the hardest denture. I mean, that denture is going to rock a little bit in the back, but now it's secure here. They can eat more. They can eat better foods. But you know what's better than that, Randy?
What's that?
More implants.
Okay.
4 implants. If you can do 4 implants, less rocking. Okay, these are dentures that snap in and snap out. Okay, so is it ideal, perfect? No, but 100% better.
What could
than
they eat with
have.
those, for example?
Most people that are starting to lose their teeth, what do the doctors tell them? Well, you need to get more fiber in your diet. Yeah, good luck with that with just regular loose dentures.
That's a good point.
Now they can eat broccoli, sauteed lightly, not fully all the way boiled, so that it's just like floating around. I mean, something that's healthy. They can eat apples again. They can eat the foods that they need to eat.
All right.
Foods that that have substance to them. Okay, but here's the thing. With just 4 implants, you don't have to have anything that just goes in and out. You can have teeth that stay in. No more denture. No more denture. It's like your 3rd set of teeth, right?
Well, it seems like everybody would want that, right? Teeth that don't come out.
Teeth that don't come out. Teeth that you feel like, well, probably potentially better than the teeth you had ever.
And with those, they could just eat whatever.
They can eat whatever they want. I mean, let's just go back. I had this fella come in. All he wanted to do was be able to eat a steak. That's it. That's all he wanted to do. And he's kind of grumpy. I mean, and in fact, it was my dad. Okay. So he comes in and he's, he calls me by my first name. He's like, Sam. He's like, whatever you do, just don't give me those white teeth. Okay. I just want to be able to eat a steak.
And he was wearing a denture, and his son's a dentist. Mm-hmm. Okay,
Yeah,
but you had worked on him for a while.
All that happened before I got out of dental school.
Okay.
See, so you help your child become a dentist, and that's going to pay off later.
Okay.
And it surely did for him. But the funny part was, we went ahead and gave him the teeth, and we gave him the smile, the white smile, and these teeth were locked in. And then, lo and behold, the next thing you know, he's in tuxedos. He's taking my mom out to dinner. They're going to dances. It truly was the best years of their life towards getting that brand new smile. Before that, didn't go anywhere. Didn't do anything. Couldn't eat steak.
When it was all done, did he say, Sam, why didn't you talk me into this earlier?
He never really said, why didn't I talk him into that earlier? But he always said, I wished I would have done it earlier.
Okay.
Now let's talk about the upper for a second. Normal denture wears, that denture covers the roof of the mouth. It goes all the way back. So imagine trying to drink coffee. I had this one patient, a young patient. She would drive from Sherman to McKinney every day to work, and she enjoyed drinking coffee. The only problem was she had dentures, and she had to wear that glue under her denture. And every time you have a cup of coffee, every time she'd finish a cup of coffee,
right?
she would have to take that denture out, and she'd have to reapply glue. And on top of that, you can't really tell that coffee is hot except with your lips and the back of your throat. So you don't feel it. You don't feel anything. You don't feel the food on the roof of your mouth. By getting rid of the roof of the mouth, okay, by getting a new set of teeth on dental implants and locking them in, you can taste foods better.
So the palate's removed when you give them a brand new set of teeth.
The palate is gone.
Okay.
No palate. Definitely the way to go. That lady, once she got her brand new smile, oh my goodness, she was so happy. She never had to use adhesive again. She could drink her coffee. And here's the beauty by getting a brand new set of teeth, by the way, is you don't have to bleach them. They stay white.
Okay. Now, the bad gum people, and you're a periodontist, so if you have the bleeding gums and the bad breath, I mean, if you have really bad gums, can you do this? I mean, will the implant stay in there, is my question, I guess.
Well, absolutely. It's the teeth that's causing the gum problem. You got the bacteria, you got the that are causing the plaque and are causing the problems around the teeth. But if the teeth are hopeless, once the teeth are gone, that gum disease is gone. See, so a lot of people feel like, well, I've got gum disease, so maybe I'm not a candidate for dental implants. But the truth of the matter is, dental implants are different than teeth, okay? Dental implants are smoother than teeth, okay? Dental implants will never get a cavity. You'll never need a root canal in a dental implant.
So you could have bad gums and do this?
Absolutely, yeah, definitely,
Really?
hands down.
Now, you're a periodontist, you're a dentist. Of course you think the smile is important. How important is the smile?
Truth of the matter is, Randy, people judge. We're not supposed to judge, but people judge. People are looking. They're looking at your smile. They look at your smile when they talk. It's your eyes and your mouth. And most research says the number one place people look at is your mouth.
Okay.
Is your smile. And here's I mean, think about the movies, okay? You go to the movies and they want to make you look poor. They want to make the actor look poor. What do they do to their teeth?
They make them bad.
They make them bad.
Bad teeth.
Right.
That's a good point.
And another thing, if they want to make somebody look dumb, what do? They take out one front tooth, right?
Yeah.
So here's the thing. Everybody wants to be accepted. Everybody wants, sometimes people wonder, they think people hate them or people don't like them or they're just not good with people when they don't realize that the gum disease in their mouth, maybe they have bad breath. Maybe people don't want to be around them, but once they have a nice, beautiful smile, all that changes.
People become more approachable.
People want to ride with you in the car now.
Okay.
People want to go to the movies with you now. People want to date you. People, all of a sudden, boom, you want to go for another job interview. You want to get a promotion, okay? Several women have come into our office, gotten a new set of teeth, and the next thing you know, boom, married.
Okay.
Okay, so I'm not a matchmaker.
I mean, it's really more than the smile, right? It's just their self-confidence. I mean, that's sexy. I mean, people with good self-confidence are more attractive.
Absolutely. Yeah, they position themselves better. Their posture's better. They hold their shoulders back, right? They're eager to be in on the conversation. They want to be involved. And so all that matters in life. And that's what everybody wants, but they don't realize
It's easy to fix.
Yes, it is so easy to fix.
So could you be too far gone to get a new set of teeth?
Oh my goodness. Randy, let me just show you this case. I mean, this patient walked in and I got so excited. This patient walked in because I knew I could help her, all right? And a lot of people come in and they think, I must be the worst case ever.
Oh my
goodness. But take a look at this case right here. This is the worst case I've ever seen. Bless her heart. Her grandchildren paid for the visit, okay? They paid for the teeth. They did not come with her because there was a bad smell. We actually had to open the doors and let the whole office air out.
Okay.
But after we're done, that smell was gone. And she was happier, and so were her grandchildren, by the way. But this is a person that now could eat, and people wanted to be around her, okay? And that's what's important, That's what people are meant to be with people. So with her options, what, a denture? Absolutely no way. I mean, take a look at her teeth. That stuff on her teeth, that's plaque, that's tartar, that's gum disease. That's affecting the rest of her body. So what I did was, We did remove the teeth. All the infection's gone. Now her body's healthier, okay? And then she came in at 8 o'clock in the morning, and by the time she left at 2 p.m. in the afternoon, bam, she's got a brand new set of teeth locked in.
That's her right there at the bottom?
She's back. Yeah, she's back.
So when they get their brand new set of teeth, how soon can they eat? I think I asked you that earlier, but they could kind of eat soft foods at the beginning, right away?
Right away.
Okay.
No, as soon as the numbness wears off, eat whatever you want. I mean, these teeth are locked in. These are your teeth. This is not a denture. This is a set of teeth. This is getting your teeth back. So here's another one I want to show you. Take a look at this lady.
All right.
All right, this is a lady. Oh, man. I mean,
that's got to be unusual.
Randy, this
something
is
that bad.
No, Randy, this is not unusual. You just don't see it because they're hiding their mouth. They're not smiling. You think they're upset. You think they're ticked off. But really, they don't show it.
Okay.
They're good at hiding.
Is it true they even tell you, Doc, I bet this is the worst you've ever seen?
They always say that. And
it's because they don't see it because these people don't smile.
Correct. And nobody shares it. Nobody talks about this. So, but take a look at this. We helped save her lower teeth. We've just made an upper denture for her. But here's the thing. It's not a denture. This thing is snapped on. It's locked on. And take a look at her smile now.
That's nice.
Oh, yeah. And she's got lipstick on. And she has customers. And now she can smile for her customers. And she can speak and not worry about anything becoming dislodged. Okay? And she can also make sure that when she smiles, she can smile really big, ear to ear, not scared at all, not putting her hand in front of her mouth. And that right there shows confidence.
Now we have to mention, we're very short on time, is Medicare doesn't cover this. Medicaid doesn't cover this.
No.
Even the best dental insurance doesn't cover dental implants.
Correct.
So what do you do for that?
Well, I tell you what, on the patients that do have coverage, we maximize every penny we can. But we have payment plans. We finance this. People can get this down to a monthly payment that they can afford. So they should just come in. They need to come in. They need to find out what their options are.
Now you have to have decent credit. Is that correct? I mean, you're not carrying the financing.
Now, you have to have decent credit. But there are lenders out there who are specialized at giving you a loan. Okay, now with the credit and the loan.
But you handle it all for them right there in the office.
Right there, yeah.
Okay.
Same day. And so once you have everything worked out to a small payment, it's affordable.
Okay, good. And they do this all the time?
All the time.
Like every single week somebody's financing this?
Several, every week.
Okay, good. Final message, somebody watching this. Maybe they're wearing a denture, maybe they're headed to a denture, but for whatever reason, they're skeptical. They're just going, I don't know. What do you say to them?
They just need to come in. They just need to remember what I always say. Who can take care of you? Dr. Sam can.
Dr. Sam can. I want to thank you for coming on the show.
My pleasure.
Good stuff. You've been watching The Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.